Heart is very close to all of us. Let it be love or let it be life. I am Dr. Sheetalkumar Hiran, Interventional Cardiologist taking care of your heart. In case of an emergency or suppose a family member gets chest pain and you suspect an heart attack, what you are supposed to do and what are the tests required? The basic test is an ECG, electrocardiogram, which will help us to find if there is a chance of a heart attack. Sometimes in initial stages the ECG may not show any problem, so doctor may suggest you to take an ECG after 20 minutes or after half an hour. And even if on the ECG the diagnosis is not very clear and which is possible, then we have to do some blood test like CPK-MB and troponin test, which will help us to identify an heart attack. There are few advanced tests in the form of 2D echo and color Doppler machine like this machine, that if we can find out regional wall motion abnormality or chance of an heart attack, the echo machine can help us to detect that. Sometimes the doctor may suggest to get the patient admitted for 24 hours in ICU if he feels that the suspicion of heart attack is very high and the diagnostic modalities are not showing it. Then even in that case it is recommended, at least for observation, get admitted for some time. And lastly is a gold standard method is to treat the heart attack patient is angiography, and if required an angioplasty in setting of an heart attack, that is called as primary angioplasty in heart attack, that is PAMI. That is the latest modality of treatment which has to be taken care within 6 hours of onset of symptoms, and that is the best possible modality of treatment available in all over the world. But unfortunately, if this modality is not available, if the cath lab or operation theatre is not available to do an angiography, then doctor may prescribe you a blood thinning medicine to dissolve the blood clot in the heart, and that will give us some breathing space and that will help to stabilize the patient. And these are the treatment modalities available for an acute heart attack condition. Thank you.